It is a very good suggestion. Keep very highly hydrated body, but at times changes in the body required intake of more water, and more so during the times of pregnancy. Water is very good answer for the purposes of negating many of the side effects of pregnancy, and they aid in the preparation of the body for these changes in physiology, and they aid in making the mother and the baby much more healthy. The role of water is very high and significant during the times of pregnancy. The fluid revitalizes the transportation systems of the body and is the mode of the carriage of the nutrients through the form of blood to the whole baby. This also negatives the fallout of infections in the urinary tracts, which are common phenomenon during such conditions and times. Drinking water during pregnancy. Hydration is improvised by drinking water, as dehydration phenomenon is very serious and dangerous. During such circumstances, hormones also undergo a sea change in the way the women try to store water during pregnant conditions. When they retain more water, they are in a position to combat such grave conditions. Much of this water is used and concentrated in an organ called amniotic sac. This fluid also needs replacement in every hour by induction of a cup of water which is stored in the body without knowing or encouraging any side effects. These water flows provide a lot of healthy functioning of kidneys of both the mother and child. An automatic protection is given to the child as well as the mother by proper replacements of water. Whenever the volumes of blood increase during the 8th month of pregnancy, intake of more water is required for correcting the situation without losing track of compensating factors to keep the situation in balance. This will also bring down hypertension as well as cardiovascular problems. Sometimes dehydrations can give rise to contractions for lack of water in the 3rd trimester, which may give rise to premature labor. This may open vistas to very many problems without losing track of giving the mother in a quarter to revitalize her body with the required level of hydration. Drinking water. It is essential to drink at least 8-ounce glasses of water every day, in addition to normal intake of recommended foods, as per strict dietary regimen. The benefits include healthier skin, less acne, removal of unnecessary sodium, and reduction of chances of premature labor or miscarriages, as well as better movements in bowels. Morning sickness can also be prevented by the recommendation of doctors for high intake of water and fluids. You should clearly note that intake of alcohol and caffeine should be avoided to mean that the best alternative is taking a lot of water for ensuring proper intake of requisite level of energy. Exercises are not predicted during such conditions. A lot of fluids will be lost during times of perspiration. Drinking water. To conclude, the benefits of drinking water during pregnancy are important for the purposes of getting all the benefits as well as charged up energies. These are for the purposes of taking up all the best situations in the world. These are for the purposes of taking best precautions for the well-being of the mother and the child. Hence, a lot water intake is very highly significant and important, including the goodness of best treatment by the best doctors.